Good afternoon, everyone, and thank you for joining us on the news briefing for this Wednesday. For decades, the county of Monterey has been managing the sandbar along the Carmel Lagoon to prevent flooding of nearby homes. It is a very complicated process. A milestone was reached yesterday with the certification of an environmental impact report, which will also open the door to protective measures. We're very pleased to have Craig Spencer, our Director of Housing and Community Development, to talk about the decision yesterday and what it means for the Carmel Lagoon area. Hi, Craig.
Hi, Maya. Thank you. I'm Craig Spencer with Housing and Community Development, and I'll be talking about the Carmel Lagoon Final Environmental Impact Report. Yesterday, the board certified the Final Environmental Impact Report, or EIR, and that was both the original 2016 draft EIR, the revised and recirculated EIR, and responses to all the comments on both the draft, the original draft and revised draft. At the same time, the board considered the preferred alternatives for how to proceed with the Carmel Lagoon management, and that included approval of a couple of alternatives that were identified in the EIR. There are really three components to this project. One is that we're doing interim sandbar management, which is the thing that happens every winter with sandbags and a pilot channel through the sandbar on the beach. That's done under permits from multiple agencies every year. And under our agreements with those agencies, we prepared the CIR to study alternatives that bring it back to its natural functioning systems while providing some level of flood protection for those residents along the lagoon. So after a study, we selected as our preferred alternatives uh, a scenic road protective structure, which is the mid-slope wall alternative, which is very similar to the emergency repairs that happened along Scenic Road in 2023 and in the winter of 2023 when there was a northerly breach of the lagoon that eroded away at Scenic Road and caused that road to be closed. So the Scenic Road protective structure would be a protective structure along Scenic Road and down in front of the parking lot at State Parks Beach to protect those areas from wave erosion and from the river erosion in the event of a northerly breach of the lagoon. Regarding the flooding issue, we studied a number of alternatives that are known as environmental protection barriers or flood walls. Those were not feasible. And so what we're proposing is ongoing sandbar management until there's a long-term solution. That long-term solution looks like it may be a home elevation program. Right now, there isn't a home elevation program in place, but the board did direct the staff to go explore grants and funding opportunities for a home elevation program. I understand this has been done along the Russian River in Sonoma County as well. Um, so there was also this provision that is a garden wall alternative. The garden walls are small walls along the lagoon that the property owners would build that would simply replace the need for sandbags along those property lines annually while we do sandbar management. And so nothing really changes until we have the long-term solutions in place. We will have to go explore grant funding and other funding opportunities for the design and construction of the scenic road protective structure, as well as explore programs for the home elevation program. And in the meantime, we'll continue to do sandbar management. We do have a website uh, where that we can provide where all the information, including the EIR and the staff report, can be found. And that's my announcement, and happy to take questions if there are any.
Thank you, Craig. You make it sound so simple, but it has been such a long, arduous process to get to where we are today. And anyone who is new to the county may not realize how long the situation at the Carmel Lagoon has gone on, and the really the complicated process that is required to do that sandbar management, which makes a solution, even though it's not yet, funded. Selecting a solution was a tremendous milestone. And I was wondering if you could share a little bit more about that, because I know you've been around long enough to know how long this has been going on.
Yeah, well, the sandbar's been managed since the early 1900s. Not all by the county, but essentially it's a natural occurrence where wave erosion builds up sand that creates a dam for the river that doesn't allow the river to exit into the ocean. And the lagoon is the mouth of the Carmel River that backs up and fills in once the sandbar builds up. And as the lagoon level rises, there are annual flood threats to a number of the low-lying homes along the lagoon. So in about the 70s, the county took over management of the sandbar and has been operating it since. So every year we get multiple permits from state and federal agencies to do the temporary sandbars and create a pilot channel. That exercise is has been refined over the years to mimic as close as possible the natural way in which that lagoon would breach absent any management of it. So the lagoon would fill up and breach that sandbar eventually at some elevation. The sandbars or the sandbags are intended to provide the opportunity for the lagoon levels to rise to a certain elevation. The pilot channel is not automatically breached by the lagoon, but it provides the opportunity for, at a certain elevation, the water to start to reach that low point in the sandbar and naturally make its way to the ocean. So we have been doing that for many years. We've been getting better at it, and we've been getting more uh, regulatory involvement in how we operate that sandbar and how long we can continue to operate it, which again is one of the reasons we studied solutions to that issue. And we're happy to have some direction forward at this point.
I did get a question in advance about the solution, the mid-wall solution, and you described it as what was done along Scenic Road following the flooding, and anyone can go down there and to look. And we were able to do it on an emergency basis. This was a crisis, and we had, FEMA support or FEMA reimbursement. This is a very expensive project. I'm wondering if you could talk about, when you search for funding, what kind of funding are you looking for?
Well, so we have a project identified, and that means we add it to our capital improvement programs, and we seek funding to both complete the final designs of the wall and to construct it. That's going to be over $7 million is the estimate at this point. So it is expensive. We don't have it funded at this point, but we work with different state and federal agencies to identify grant funding opportunities for things that protect public infrastructure, and other climate related grant opportunities to help provide some funding. And so that will start occurring. It has been occurring until we have the funding we need to complete that portion of the project. And yes, they're in 2023. So the sandbar management happens according to regulatory permits. And there is a desire from the regulators to allow for what's known as a northerly breach of the lagoon. There's an arm that goes to the north in front of the state park parking lot on the river beach. In 2023, the lagoon breached to the north, which led the Carmel River to exit at the northerly side of the beach, which runs along the edge of Scenic Road. And so as the river exits along the bottom of Scenic Road, it erodes away at the bank under Scenic Road. And we had a slip out on the side of Scenic Road that caused the road to be closed. We had to do an emergency repair, which is a shotcrete retaining wall on the edge of Scenic Road, to repair that section of road before it could be opened. So that was all done in 2023 under emergency condition on a portion of Scenic Road. This Scenic Road protective structure would extend that both north and south.
And then the only other question I had is if you could look at a timeline for this. I know that's, there's no crystal ball on when funding will come in, and you're putting it into the capital improvement, spreadsheet, as it were. If somebody wanted to monitor the project, when is it realistic to think that this could get started?
It's a good question.
Unknown.
It's going to depend on how competitive we are for the funding opportunities. We have the Carmel River Free project, which has some similarities. That did help. We did get large amounts of funding from the state for. So that took 5 years, I think, or more in working out that process. So it could take years.
Well, but still, I guess we can celebrate the milestone that a project was identified after so many years of discussion, and then just try to keep celebrating, keep our spirits up until the funding comes through.
Yes, and in the meantime, we'll continue doing sandbar management.
Craig, I really appreciate you dropping in and talking about the project. I know it just happened yesterday, but I think it's really great to get the information out because people see this happening every year and they long for a solution. And now we've at least got the solution identified.
Yes.
Moving on to our next topic today, there is a special workshop that is happening this afternoon in Soledad to help those who may need support and navigating our local medical system to get the healthcare that they need. This is a collaborative workshop between Natividad Medical Center and the county's CORE program. And if you don't know the CORE program, CORE stands for Community Reaching for Equity. Jennifer Rivas is from the health department, and she's here to talk about the project this afternoon, the workshop, and then tell us a little bit more about CORE. Hi, Jennifer.
Hey, thank you for the invitation. Will I be able to share my screen?
Yes, please. And for those who may be wondering, Jennifer is going to give her presentation in both English and Spanish.
Yeah. Well, hi, everyone. Again, my name is Jennifer Rivas. I'm a management analyst with the administration team in our health department. I am super excited to share a bit about our CORE program, which is focused on bringing essential services and resources directly to our community. This presentation will be brief, our program contact information will be available at the end. So I encourage you to connect with us via phone or stopping by in any of our community events or workshops. As you will hear, our program is here to support you, answer questions, and connect you with the help you need. I will be delivering this presentation in both English and Spanish, so you will be seeing a couple English slides and Spanish slides. Hola a todos, mi nombre es Jennifer Rivas y soy analista de gestión con el equipo de administración en nuestro departamento de salud. Estoy emocionada de compartir un poco sobre nuestro programa CORE, que se enfoca en llevar servicios y recursos esenciales directamente a nuestra comunidad. Esta presentación será breve y les animo a conectarse con nosotros vía una llamada telefónica o en nuestros talleres. Estamos aquí para apoyarlos, responder a sus preguntas y conectarlos con la ayuda que necesitan. Al final de la presentación compartiremos la información de contacto de nuestro programa y también les invito a pasar por nuestras mesas si nos ven ahí por la ciudad. Okay. And my screen is sharing good. Okay. So our services, we have two general umbrellas for our services. We have system navigation and linkages to medical care as part of our CORE program. Under system navigation, we help community members find and access community resource that supports their health and social needs. We also work with the clients to empower them to access or explore new opportunities that may align with their health goals or with their social needs. Under linkages to medical care, we provide assistance via supporting filling out the applications of Medi-Cal, CalFresh, scheduling appointments with the provider, organizing those appointments, providing basic health education around mental health, as well as Narcan and Narcan trainings. Both of these categories encompass our care coordination services. So we provide one-on-one support with community members to connect, as I mentioned, to local resources, offer education, and as well as checking in regularly with our clients to ensure that there's progress on their goals or progress in accessing the resources or services that they need. If there are any challenges that come up once a referral has been made or once the information has been delivered to the client in accessing the services, we work to figure out solutions to those challenges to increase access to care and access to our community resources and services. So en nuestros servicios tenemos dos categorías en general donde caen nuestros diferentes servicios. Tenemos navegación de sistemas y conexión a cuidado médico o conexión a cuidado de salud. Bajo navegación de sistemas, ayudamos a los miembros de la comunidad a encontrar y acceder a recursos que apoyan su salud y necesidades sociales. También trabajamos con la comunidad para empoderar a los miembros para que exploren nuevas oportunidades que a lo mejor les pueden ayudar en esas necesidades que tienen. Bajo conexiones de cuidado médico o de salud, ayudamos con el acceso a servicios médicos, brindando apoyo con las solicitudes de Medi-Cal, coordinando citas médicas o ofreciendo programas educativos sobre salud, incluyendo capacitación en el uso de naloxone. Esas dos categorías implementamos nuestra coordinación de cuidados. Lo que hacemos es brindamos apoyo individual. Trabajamos contigo uno a uno a conectar, a identificar qué son esas necesidades y qué son los servicios que les pueden ayudar. Les ayudamos con los recursos locales, ofrecemos educación y mantenemos un seguimiento regular para ayudarles a alcanzar sus metas de salud o acceder a esos recursos o servicios que necesitan. A little bit more about our care coordination and specific areas that we provide that support. So clients will work with our community health workers who will identify the different needs or any needs around health education and provide basic health education. On the screen, you will see at the center, we have our community health workers who work with our clients. And as we do the assessment with our clients, we identify the different linkages that that may be available to connect the client to a resource and support and assist them with navigating to that resource and ensuring that they're well prepared to access it or apply for them. You'll see supports around application supports such as Medi-Cal, CalFresh, understanding school paperwork, understanding just general housing application, as well as helping them fill out those applications. Mental health referrals. So we refer various clients to mental health services, working with them to see what type of service support is needed. Is it therapy? Is it counseling? Is it grief support? And seeing what's available for them. Social services, as well as transportation services and connections, understanding Medi-Cal benefit for transportation, how to plan ahead to make that request transportation from your Medi-Cal insurance, right? Understanding that and really building client self-sufficiency and being able to access those resources moving forward to access care. Under primary care, we provide health literacy education. We assist in connecting to primary care services or changing primary care providers. And this is all done through a closed loop referral. We want to ensure that when we connect someone, that we follow them through that navigation, through that journey, so they can actually access the service that they need. Son nuestros servicios. Quiero hablar un poco más de nuestras coordinaciones del cuidado. Los clientes trabajan con nuestros promotores de salud que les ayuda a identificar qué son las diferentes necesidades. Aquí en la pantalla, miren que al centro tenemos nuestros promotores de salud que trabajan con el cliente y ayudan a ver qué son las diferentes necesidades, qué es la educación o servicios de recursos que necesitan. En la pantalla pueden mirar que ayudamos con apoyo para llenar aplicaciones, ayudamos con el Medi-Cal, CalFresh, citas con el consulado, aplicaciones para recibir o aplicar para un GED, cosas así. Referencias para servicios de salud mental, averiguamos qué son los servicios que están disponibles para ustedes, qué cubre su aseguranza o qué otras actividades está pasando cerca de ustedes. Servicios sociales y transportación son otros servicios que ayudamos a acceder. Para transportación, entendiendo su beneficio de medical. Si tienen medical, tienen un servicio para transporte a su cita médica. Ayudamos a entender cómo se usa ese servicio, así que ya para el futuro puedan acceder sus citas sin un challenge de transporte. Cuidado de salud, ayudamos con educación sobre varios temas de salud, conectando también a nuestros clientes a servicios de cuidado primario o cambiando sus doctores si es eso algo que quieren. Todo esto se usa o se da como un apoyo así de principio al fin. Nosotros cuando les conectamos con un servicio, queremos estar con ustedes para saber si pudieron acceder a ese servicio. Cuando les conectamos, hay que decir hoy, vamos a hablarles unos días después para ver si pudieron conectar, hacer cita o qué retos estaban enfrentando donde no ya pueden acceder a ese servicio. Y parte de nuestros servicios damos workshops. A part of our services, we provide workshops around mental health, Narcan, as well as how to prepare for your doctor visits. We have couple more topics in the works, but these are some of the ones that we have provided out in the community thus far. We have one around conversations on mental health, so how to have that conversation with your loved ones. We have Narcan training and fentanyl awareness training. We also provide Narcan to those who attend. Also in our one-on-one services, if someone requests Narcan, we have that available. We also have Your Health, Your Voice, where we prepare people, our community members, how to prepare for their doctor's visits, what kind of questions to ask, what medications they have questions about, and how to formulate those questions and, advocate for themselves at a doctor's visits. All of these services are free. Son nuestros servicios. Tenemos unos talleres también, aparte del servicio directo con nuestras comunidades. Se ofrecen talleres virtuales y presentaciones sobre temas como conversaciones sobre salud mental, cómo tener esa conversación con los que aman, con sus familias, con sus amigos, colegas. Tenemos capacitación en Narcan y qué es el fentanilo. También proveemos las cajas de Narcan y les enseñamos cómo usar y administrar Narcan a alguien que a lo mejor está pasando por una sobredosis. Y tenemos otra presentación de Tu Salud, Tu Voz, donde les ayudamos a aprender de diferentes estrategias de cómo prepararse para su cita del doctor. Y todos los servicios son gratis, los talleres y los servicios directos. So accessing our services, to be eligible for our core program, you do have to be 18 years or older and live in Monterey County and be in need of any of these services, either linkages to medical care or system navigation. If you don't know if you qualify, just call us and we'll be able to help you out. ¿Cómo acceder a nuestros servicios? Para clarificar el programa, para calificar al programa CORE, tienen que ser mayor de 18 y vivir en el condado de Monterey. Deben que necesitar ayudas con lo que había mencionado, Si no saben si califican, nomás llámenos y nosotros podemos trabajar con ustedes. To access our services, there's various ways. You are able to self-refer to our program using our website link. There will be a very short form that you can fill out with your contact information and the needs that you have. If you're an agency who wants to refer your client to a community member, you may also do so on our website. We also have a form for that. You may call us directly at 831-809-9870 and connect with our program assistant who will work with you, or email us at our core email as shown on the screen. ¿Cómo pueden aplicar al programa de CORE? Se pueden referir a sí mismos usando un formulario que tenemos en nuestro sitio web. O si son una agencia que quieren referir a uno de sus clientes o un miembro de su comunidad, también pueden meter un formulario que incluye sus nombres, quién es el cliente, qué tipo de necesidad, y nosotros podemos ver ese formulario y contactar al cliente. Si quieren conectar directamente con nosotros, pueden llamarnos al 831-809-9870 y conectar con nosotros con cualquier pregunta o necesidad que tienen. También nos pueden mandar un correo electrónico a nuestro core email que está en la pantalla. También, we also have couple drop-in services available where community health workers are at these locations physically providing that direct support. We have the Soledad Family Resource Center where our team members are the first and third Wednesday of each month. And coming soon, as of October, we will have a Castroville and Greenfield drop-in center. For Castroville, we will be there the first and third Monday. And for Greenfield, we'll also be the first and third Monday of every month, starting in October. So, unos horarios de nuestro drop-in de servicios. So, nos pueden contactar lunes a viernes de 8 a 5, pero también tenemos diferentes lugares donde pueden conectarse directamente con nosotros en persona. Eso es en el Centro de Recursos de Familia en Soledad. Estamos ahí cada primer y tercer miércoles. Y en octubre vamos a tener nuestros promotores de salud en el Centro de Recursos Familiares de Castroville y también en Greenfield cada primer y tercer lunes del mes, comenzando en octubre. So a couple of coming workshops. We have our Preparing for Your Doctor's Visits workshop. This is part of our Harvesting Health series. We have a wonderful collaborative partnership with the Natividad Family Medicine Residency Program where we have a doctor go out into the community and present about various different topics. So the next one is actually today at 4:30 at our Soledad Family Resource Center. We'll have raffles, we'll have snacks, and you'll be able to learn about, how to talk to your doctor about your health, understanding medical advice, advocating for your care directly presented by one of the doctors. So, hoy vamos a tener un taller sobre cómo prepararse para sus citas médicas con el doctor Bilal en Soledad. Y allí nos van a poder aprender directamente de un doctor del hospital sobre cómo hablar hablar con su médico sobre su salud, entender consejos médicos, abogar por su cuidado y también aprender del programa CORE. Eso será hoy a las 4:30 en el Centro de Recursos de Soledad. Habrá una rifa y botanas. And next week, we have another presentation or workshop as again part of our Harvesting Health initiative. We will have a nutrition workshop with 2 of the doctor residents. They'll be teaching about nutrition and the links between cardiovascular health. We will also partner with the food bank, so those who attend would be able to take a box of food home, and we'll also have a raffle. So that's going to be next Wednesday at 4:30. So that's September 18th, and also at the Soledad Family Resource Center. So próxima semana vamos a tener otro taller de cocina. Es parte de nuestra serie de Cosechando Salud, donde van a aprender sobre nutrición y salud cardiovascular, su salud del corazón, básicamente, con 2 doctores del Hospital de Natividad. Y también hicimos partner con el Food Bank y van a proveer cajas de comida para los que atiendan. Va a haber una rifa también, y eso será próximo miércoles a las 4:30, septiembre 18. And this is our contact information. We have our phone number, our email, and our website linked here. So feel free to connect with us. Y aquí está nuestro contacto. Nos pueden llamar, mandar un email o conectar vía nuestro sitio web. Y esperamos su llamada. Gracias. Thank you.
Thank you so much, Jennifer, for walking us through CORE and then walking us also through the workshops that are happening. I'm going to have you stop sharing your screen because I do have a question for you. The workshop that's today and then the one that's next week, they're happening at the Soledad, the center there, more accessible for people who live in the area. It also seems like the program is bringing this important medical information in a more relaxed setting where sometimes people may feel a little intimidated. I don't know how to make a doctor's appointment, or I'm not sure where I should go. But here is this medical information right there, near where they live. Is that part of the goal of the program?
Yeah, that's part of our how to prepare for your doctor's visits. Is we will have community health workers who, if anyone has specific questions, just like the ones you mentioned, they can connect with them after the presentation. Or I hope we're creating safe spaces for people to share these questions in the group setting where we have our community health workers who can provide information, or also our providers who could fill in the gaps. So definitely, yeah.
And the community health workers, which are they are just tremendous workers in the community. If anyone has never met them, they are just wonderful, all of them. They really are the link between the community that is in need and the services. Is that how they basically are getting people to sign up for your program?
Yes, and they're also the ones providing the more of the assessment and the linkages, right? So those who may be hesitant to reach out to a certain service, to a certain resource, or just don't know how to even get started, we have our community health workers who are trained in having those conversations, encouraging them to access those services, explaining the different options that they have, and really working with the client to the client knows what's best for them and what will work for them. So giving them those options to start taking those steps to access that care, to either access the services that they really need in regards to, their social life or their care. So yeah, they are fabulous at what they do.
And then one last question about Narcan. In your presentation, you talked about some Narcan training. How is that picking up interest in these communities? Because, the opioid crisis is everywhere. It doesn't pick and choose what community it's going to impact.
There is. It's actually very well received when we're out tabling, informing people about CORE program, but we also have Narcan there available for people to just take with them. Before they leave with the Narcan, they always receive a demonstration on how it's used and what it's used for. We have been learning that there may be some misinformation around what they think it may be, like allergy medication, something around that realms where it's like, nope, we can't use that for that. And this is how it's used, and this is why we use it, right? So our presentation touches on some of those, the misinformation going around, but also what it is, what it's used for, and what is fentanyl and how, where can people access that, how easily accessible and how easy it is to, if you come in contact with that, to potentially have an overdose. So we explain that our presentations are both in English and in Spanish. So if there are agencies who would like to have presentations like that for their community members, they can also reach out to us and could coordinate that.
Thank you so much, Jennifer, for talking about this today. Really good luck with today's presentation in this afternoon, and then also next week as well. And we hope to have you back and bring some of those community healthcare workers with you because we just love them.
Yeah, thank you.
And thank you, everyone, for joining us on the news briefing this week. Our next briefing is next week. We'll see you then.